Our next speaker would be Dr. Pooja Khamar.
A very good afternoon to all. At the outset, I have no financial disclosures pertaining to the study, and none of my co-authors have. So we are going to navigate through the worldwide impact of dry eye disease, the background and need for personalized intervention, the purpose of the study and why we need to study the role of tier biomarkers, how do we analyze the same, the results, and how to customize the treatment using this biomarker analysis. We come across this two group of patients in our everyday dry eye disease practice. One group of patients, they do respond to our treatment, but the second group of patient remains dissatisfied. And they start taking different treatment options, multiple medications, and also at times modern day dry eye therapies, but they remain dissatisfied. A non-responder is a patient who sometimes does not respond to our treatment despite and have clinical symptoms, a tear film instability, and also the corneal surface integrity is not maintained despite treatment, and that is what is known as a non-responder. The global prevalence of dry eye disease is increasing. As many as 350 million patients being affected by dry eye disease every year. And out of them, 60% of the patients report a reduced quality of life when it comes to their routine practices. And this also increases the financial burden to the market and to the families as well because of chronic medications. So we do need to, there's a crucial need of identifying these non-responders using advanced diagnostic technologies and how we can offer a customized approach for the same. So we wanted to identify that why do some patients do not respond to our dry eye disease treatment when they walk into our clinic, and also whether we can have a tailor-made approach strategy for these non-responders and reduce the risk of these non-responders in this clinic and have a happy patient. So our group has developed this Biomarkers Pathfinder kit, which analyzes 8 inflammatory and non-inflammatory biomarkers using a centrifugal technique. It's an ELISA-based technique, and it uses a microfluidic system. We can collect tears using the Schirmer strip, like how we do in a dry eye disease test, but rather than discarding the Schirmer strip, we collect it in an Eppendorf tube and add a patented buffer solution to this tube. We shake the tube for 5 minutes, and after 5 minutes, whatever proteins are eluted in this solution is then taken and incorporated in this well, and then this well is put into a analyzing system, which is the Biomarkers Pathfinder kit. At the end of 90 minutes, we get this biomarker report where each of the biomarker value is given for each of the eye, and based on the reference interval, just like a hemogram or a CBC report, we can see whether it's normal or abnormal. We recruited 502,070 patients who walked into our dry eye clinic, and based on TFOS due to classification, the treatments was initiated. They were followed up at 3 and 6 months, and dry eye metrics and a comprehensive dry eye questionnaire was taken for them, and the non-responders were identified. Further, the non-responders underwent a tier biomarker testing using the Biomarkers Pathfinder kit, and a personalized biomarker-based therapy was initiated for these non-responders. 64% of the patients were identified in our clinic, out of which 27% patients had high MMP9 levels, 17% patients had high ICAM levels, and 20% patients had high combined biomarker levels. Based on the fold rise of MMP9, they were started on trehalose-based drops, or a combination of trehalose and cyclosporin, or a combination of trehalose, cyclosporin, and a vector pulsation therapy. And post-treatment, the non-responders rate reduced to 2.3%. 17% patients showed high levels of ICAM1, where the lifitegrast and trehalose combination was started, and post-treatment, the non-responder rate reduced to 0.7%. For IL-17 patient, the group which is very nicely known as the pain without stain patient, either a sitting of vector pulsation therapy or 3 sittings of IPL were given, and post-treatment, the non-responder rate reduced by 11.2%. And the combined group, where all the biomarkers were on the higher side, a combined therapy of 3 sittings of IPL therapy, trehalose, and doxycycline was initiated, and post-therapy, the non-responders rate reduced to 0.6%. And a combined rate of non-responders from 64% reduced to 4.4% with this targeted therapy based on biomarkers. So using a Biomarkers Pathfinder kit and the reports which are generated, it is not only cost effective to the patient but also to the global market, and the test for 8 biomarkers cost not more than 1,500 rupees, and it can be done by a single trained technician, and it is as small as a projector which can be kept in your clinics as well. So this is the first time in world biomarker kit which may be used to discover and stratify specific abnormal levels of biomarkers and treat them for inflammation as targeted therapy, and more economical management can be given by avoidance of multi-drug therapy in patients with previous treatment failures. This kit can also be used for keratoconic patients, post-op unhappy cataract and refractive surgery patients, diabetic retinopathy patients, myopia and glaucoma. So this kit is ready for use in our clinics.
And my team for helping me present this work on their behalf. Thank you.